What's up, guys? Doc Brownbeer here. Doing a video for y'all for cold weather. I did a video last night for your packing list of what you should bring. Today's video information comes out of the Journal of Special Operations Medicine, my Tactical Paramedic book. Lots of good resources if anybody's available or interested in getting one. Let's jump right into it. So there's some special considerations for cold injuries. If you have frostbite or some sort of injury like that where your body is frozen in any way, if there's a chance that you can refreeze the injury after thawing it, that can and most likely will lead to an amputation of that limb or body part. So we'll jump right over here into signs and symptoms. Signs and symptoms, we have hypothermia, which is a low core temperature. We have our freezing cold injuries, so our frostbite, and then our non-freezing cold injuries. These are the three categories that we break it down into. For hypothermia, our evacuation plan is going to be an urgent evacuation if you have severe and moderate hypothermia. But starting off with a mild, you're going to be shivering and you're going to have poor coordination. Moving up to mild, I'm sorry, I can't talk today, guys. I'm still working on getting over that cold. Forgive me. Up to your moderate, again, that's an urgent transport out. You're not going to be shivering anymore. You're going to be disorientated. You're going to have slurred speech and confusion. Kind of what you would see in somebody that's intoxicated. Look for something similar there. And so for the severe hypothermia, the person is going to be unresponsive. So your freezing cold injuries, your frostbite, this is going to be a priority evac. You have superficial and you have deep when you have frostbite injuries. Your superficial is going to be where your skin is firm but not frozen completely. And it's going to be painful and it's going to be red. Your deep frostbite injuries, you're going to have no pain. Your skin is going to be grayish. It's going to be completely hard. The skin can also look white, gray, ashy, or waxy in appearance. Moving down onto our non-freezing injuries. This is going to be a routine evac. This is, it kind of goes into the hypothermia section of the mild. It's going to be similar symptoms. If you have that mild hypothermia, it's possible that you would have a non-freezing cold injury. So I think it's called Chillins. Well, I can't remember how to pronounce it off the top of my head, but it's just another non-freezing injury. But you're going to have itchy, pale, cool, blotchy, wet skin. You're going to have the numbness and the tingling that goes with it. How are we going to deal with it? We got our management section here. Give you all a quick view here. Forgive me, I'm in the kitchen for that glare. It's a little dark outside to be doing a video out where I normally do it. For your non-freezing injuries, you're going to gently dry the area if it's wet. Do not rub any of our cold injuries. It's very counterintuitive. It can actually lead to more injury. Elevate the feet. Hydrate orally. So drink your water. That kind of goes back to what I was saying in my last video. Make sure you're drinking water out there in the field because you can become dehydrated and dehydration can also jump into these cold injuries fairly quickly, especially in a cold, windy environment like Camp Bayak. Your dry socks. I know that's kind of the running joke in the military, but it really does make a difference. And your NSAIDs are going to be ibuprofen for pain management. In your freezing injuries, do not walk if you have frostbite on your toes unless your life is in danger. That's going to be something where you're trapped out in the middle of the forest in deep snow like Montana or something. Unless you have to walk, don't do it. Do not rub snow or ice on it. So let's say you got frostbite on your toes, let's stick with that one. Don't rub it with snow or ice. That's an old myth that is stupid and should go away. So don't do it. Do not rub or even rub vigorously. Again, it's counterintuitive. It can cause more injury. What you do is put them in a warm environment, shielding them from the wind. You can use hand warmers. If you have the MRE warmers available, you can put that in their armpits, in their groin, and along the neck, as well as on the chest. Don't put if it's going to be the MRE heater, do not put it directly on the skin. Make sure there's an article of clothing separating it. You don't want to cause them burns. And speaking of burns, I'm going to be doing a video here pretty quick on that. Since I won't be with you guys, this drill, I have to go down to Springfield with all the other medics and teach a class down there on burns. So I'm going to do an in-person class down there, as well as doing a video for you guys on it. Motrin for pain management, 800 milligrams. PO is for taking it orally, so swallowing it. If there's a chance that you can refreeze the injury, again, that goes up to our special consideration. Do not thaw out the area. Wrap it in dry Kerlix or gauze. If refreezing is not likely, so you're going to get out of there pretty quick and you're going to the hospital kind of thing. For your superficial freezing injuries, you're going to want a warm water immersion. Add the heating pads. If they have blisters that are clear, you can go ahead and drain them, and then apply soft, loose dressings. Moving on down to our deep freezing injuries. Again, with the warm water immersion, you want the temperature of that between 104 and 108 degrees Fahrenheit, and that's going to be until the skin softens up again. And that's going to be about 30-minute process. When you're doing this with the freezing injuries, so your frostbite, that's going to be extremely painful. And you guys out in the field, if I'm not with you, or Koppel's not with you, or some other medic that doesn't have like narcotics or opiates, go ahead and use that Motrin. You can throw 1,000 milligrams of Tylenol on that as well. Those mix nicely. It's not going to be as much pain management as this person is going to need, but it's a start. But you guys can't give ketamine, morphine, all that kind of stuff anyway, so you don't really need to worry about that kind of stuff. Just stick with your Motrin and your Tylenol. And again, apply loose dressings. Excuse me. For hypothermia, it's very similar process to your heat injuries. like what we talked about when we went down to California, Camp Roberts and Hunter Liggett this summer. You're going to remove them from the environment into a warmer area. Remove any wet clothing. Shield them from the wind. If they are conscious and able to eat and drink, you can go ahead and give them some food and water. That's okay. If they're in that mild hypothermia, so just the shivering and the poor coordination, go ahead and have them exercise lightly in place. Don't smoke the dog shit out of them. For your severe or moderate hypothermia, again, that's your no more shivering, you're unresponsive on the severe, slurred speech, so your drunkenness, kind of a feel to it. Do not exercise. Lay them in the supine position. Don't give them food or water. If they're unresponsive, they're not going to be able to take it anyway. If IV fluids are going to be necessary, Joe's, this isn't necessarily something for you, but for any medics that watch this video, you're going to want your bag of fluids at about 101 degrees, almost 102 degrees Fahrenheit, with some D50 if you have it. If you don't and your person is responsive, give them a little bit of sugar in the gum line. That'll help a little bit. We don't have a fluid warmer in our FLA. So what we would have to do is put that bag of fluids against our skin underneath all of our clothing. That's the best way that we can warm that up. When we deploy, we might have a fluid warmer. It's a pretty big base, so I would assume that we would. But that's something for another time. Begin rewarming. The hypothermia, you don't have to worry about any of those special considerations for the refreezing and the amputation. This is a little bit easier to deal with. If unresponsive, avoid sudden movements. This can increase the risk of ventricular fibrillation. For you non-medical folk, that means that their heart can go wonky. If you guys would like, let me know in the comments below, and I can do a short video on what that looks like. If you guys are interested, just let me know about that one. But the key there is it can screw up your heart. Maintain the airway if they're unresponsive, so putting in a NPA or nose trumpet if you have one. And continually check their vitals, preferably every 10 to 15 minutes. Make sure you write them down on a piece of paper. If you don't have paper, grab some tape. If you don't have tape, write it on their chest with a permanent marker. If the person is not breathing, start ventilation. So rescue breathing. At this point, you're not going to do the CPR if they have a pulse. If they do not have a pulse, zero pulse, you're going to start CPR. I know a lot of you don't know everything that goes into it. That's fine. You're going to want 30 compressions. After 30, you go to 2 rescue breaths. There is some evidence that supports the idea of not needing a rescue breath because the compressions move air in and out of the lungs. But for now, until otherwise told, go ahead and do 30 to 2. I'm working on getting my instructor certification for CPR, and I will get you guys all through that course as soon as I can. But that is cold weather injuries in a nutshell. There can be a lot more that goes into it. If you guys have questions, hit me up. y'all should have my number. If you don't, hit at me on Facebook or in the comments below. If you have questions, let me know. I'll take care of them. Again, this is Doc Brown Bear. This was made by Private Robinson. Shout out to him. He's going to be putting on an intro video with this. It's pretty cool. It won't have it in this video because he was unavailable today. I got to get this in and up on YouTube so I can send Sergeant Taylor the link so we can get it in the newsletter for all those guys that are not on the company page or in the 3rd Platoon page. Have a great night. See you guys later. Have a good day.